Today I'm joined with Dr. Colleen Moore, a vascular surgeon at Prairie Cardiovascular, here to talk about peripheral arterial disease. Thank you so much for joining us.
Thank you for having me.
So for those who may not be familiar, tell us a little bit about this disease and what we should know.
Peripheral vascular disease is a vascular and arterial disease that affects the blood vessels outside the heart, typically associated with blood vessel disease in your legs, can also be in your neck. And so that's what we treat and take care of.
And let's talk about some of the symptoms and risk factors that we should be aware of with this disease.
The risk factors for developing peripheral arterial disease are similar to those for cardiac disease. It's high blood pressure, high cholesterol, diabetes, age, and smoking are the big risk factors. The things that we look for in patients are people who go to walk and they develop calf cramping and can't walk any farther because their calves hurt. And those would be the early warning signs of peripheral vascular disease.
Now, is a disease like PAD something that is prevented?
It's not typically you can prevent it, I guess, by not smoking, managing your blood sugars, and keeping your cholesterol levels low.
Okay, and let's also talk about the treatment options that are available for this disease.
Treatment options for peripheral vascular disease include some medications to help it from progressing. We don't have any medications that reverse it, but we can keep it from progressing. Other things would be exercise therapy. So we have some structured exercise programs where people can come walk, similar to cardiac rehab, and help strengthen those leg muscles and arteries. Lastly, if it progresses to the point where you need something done, there are surgeries or other non-invasive therapies we can do.
Excellent. Well, thank you so much, Dr. Moore, for joining us and sharing all this information with us about peripheral arterial disease.